As we reflect on the past year, we celebrate a year of outstanding achievements as we continue to make an impact on the healthcare of WA's sick children. With the support of our donors, we've helped realise dreams that started as an idea and grew into powerful, often game-changing projects. Projects like the Burn Centre of Excellence, providing world-leading treatment for a common injury that can instantly change the course of a young child's life. The NETS Ambulance, a game-changing service transporting critically ill babies to hospital. And of course, the Artist in Residence program, brightening the lives of sick children and their families. From humble beginnings, we are immensely proud to celebrate. From little things, big things grow.
From the moment I became pregnant, from the very first scan, there was some abnormalities appearing on the scan that they started testing for viruses, for things like that. She was an emergency C-section at 34 weeks. And then from then she failed to thrive in hospital. I just knew from the beginning there was just something going on with her.
So rare is a misnomer. Rare is so common cumulatively. Because there's 8,000 different rare disorders, there's 63,000 kids living with a rare disease in WA. From data in the USA, which corroborates what we found locally, we now know that rare diseases are the single biggest cost in the health system. If something's individually rare, how do you know how best to treat it? And how do you plan for the future? How do we get even better about globally connecting? Rare care is a world first. And the reason why it's a world first is we're taking a novel approach, an approach where we think about the whole life journey of the children and work together with all of the sectors involved in their lives. Education, disability, insurance, health, employment. So we're enormously grateful to the Perth Children's Hospital Foundation contributing $2.5 million. Rare care is about helping children and families with rare and undiagnosed diseases live the best lives possible.
I feel very grateful that I've been getting special help. It's very, very grateful.
Right now, 50% of all deaths under 5 years of age are happening in the newborn period, most of those within the first few days of birth. That's a big problem. That's millions of deaths every single year. Unfortunately, many of these deaths happen in low-resource settings and marginalized populations even within our own countries, and they need a champion, and that is us. The mission of the Human Vaccines Project is that one vaccine given to anyone, any one time during life, anywhere in the world, is going to protect you from whatever the target is for that vaccine. That mission is going to be first realized amongst the participating partners of the Human Vaccines Project, and that now includes Australia. Thank you. Thank you for the support of the Perth Children's Hospital Foundation. Get ready for an explosive change in a wide range of actions that will benefit newborns all over the place in Australia and around the world.
This is the only paediatric simulation fellowship in WA, and so it's a sought-after position. It allows a senior trainee to develop simulation skills, not only just the skills, but to hone and become an expert in running simulation, which would be very difficult to get from anywhere else. Really, our focus is about trying to improve patient care through the simulations, trying to relate the learning and make our scenarios as realistic as possible to make it relevant to our clinical practice. Obviously, the sim suite looks like the ward environment, so it feels like you're on the ward when you're doing the scenarios. The mannequins that we're using these days help make it really realistic. They move, they talk, they blink. You can examine them and get the clinical findings like you would in a real patient.
Mary is a 9-year-old child with cystic fibrosis. She was diagnosed through newborn screening, and we do everything we can to keep her well every single day so she can do the things that she needs and wants to do. It's a condition that affects her respiratory system primarily. She's always had to have physio every single day. She's generally got quite a good attitude towards it. She quite likes being the only child in school with cystic fibrosis, but the downsides are having to do physio twice a day can be challenging. It's not much fun for Mary. And as she's getting older, she's saying, I don't want to have cystic fibrosis, I don't want to do physio. I had my fingers crossed that we were going to be able to be selected for the surfing study, and we were, so that was just great news.
When I'm out in the water and I'm surfing, I feel like I'm more freer. My body feels like stronger, more in control of things. I loved it. It was 11 out of 10.
This program is really meaningful, and I just think it's another approach to caring for kids with chronic conditions. She was always happy to go, big smile on her face as we were leaving, and happy to come back the next day. So it was just wonderful. Having a whole approach to her well-being is just, it makes sense. And just from our experience and how amazing it was and how beneficial, it would be wonderful for other kids and families to have that same chance.
The Foundation has had yet another successful year. Through the support of our generous donors, we've been able to provide grants to Perth Children's Hospital and the Waiata Child and Adolescent Health Service to the value of an amazing $6.95 million.
When I stop and think about it, every single grant that the Foundation makes starts with someone coming up with a great idea. The Kids Bridge, which has just been completed, is just a spectacular example of that. It's linking the bushland in Kings Park to the hospital and allowing patients, their families, the staff to have a unique and special experience, and ultimately benefits the entire broader community. Another one of the great ideas was to build Western Australia's first children's hospice down on Swan Lawn by the beach. This project has been developing for over 2 years now, and we're on track to start building it in 2023. This will be a facility which transforms the experience of families that have children with life-limiting conditions. Another one of the great ideas is the development of the green space, that sort of green patch between the hospital and the car park. That's going to be transformed into an amazing playground where kids, the family, staff, and even members of the local community can learn about the flora, learn about Aboriginal traditions from around our area, and have a transformative experience right at the doorstep of the hospital.
These projects and many more are only possible thanks to our generous donors. So to you, our donors, we say a heartfelt thank you, and we look forward to continuing the journey on the front line of children's healthcare.